Thank you, everybody, for participating in this joint news conference. This is going to provide updated information on COVID-19 in Imperial County. So just to briefly introduce everyone, we have Dr. Stephen Monday, the Imperial County Health Officer. We have Tony Rejodes Jr., Chief Executive Officer for Imperial County. Supervisor Luis A. Blancarte, Imperial County Board of Supervisors, Jeanette Angulo, Director for the Imperial County Public Health Department, Mr. Larry Lewis, CEO for Pioneers Memorial Healthcare District, and Adolph Edwards, CEO for El Centro Regional Medical Center. And so the order that we're going to do this, we're going to start with public health to provide a brief update, and then we're gonna pass it on to Larry Lewis from Pioneers, followed by Dr. Edward from El Centro Regional, and then our county CEO and county supervisors. And then we'll open it up to questions from our media. So if you can also please place your cameras, your microphones on mute while everyone's speaking, that will really help. So with that, we'll get started with our County Health Officer, Dr. Stephen Monday.
Thanks very much, Medea. Hi, everybody. Good afternoon. So just really quickly, we have now had more than 48.5 million cases worldwide and over 1.2 million deaths. Here in California, we have had over 940,000 cases and 17,700 deaths. In Imperial County, we've had over 13,000 cases and 340 deaths. Our recent case counts per the state's COVID-19 website, we are at 32.2 per 100,000, but that was adjusted downward to 21.8. And as everyone is probably aware, that means that our state that our testing capacity is actually above what the state median is. That's why they adjusted downward. Our testing percentage is 8.4%. And of course, our goal, I think everyone knows, but just to say it, is to be below 8%. And our equity population, which again is based on that Healthy Places Index, is 11.3%. Just for a frame of reference, the state average case count is 7.7 per 100,000. So that means as a state that we are above the goal, which is to be below 7. So Imperial County remains in the purple color, which we have been since all of this originally started. So in terms of the questions, I only actually, I believe, have one that was forwarded to me, unless or Andrea missed one. And that has to do with, from Mario Conde from Beyond Borders Gazette. And it has to do with testing capacity in our test sites. And since our Deputy Director for Environmental Health, Jeff Lamore, is the person who is managing that and is our contact person with the state, I'm going to allow him to weigh in on those questions. So Jeff, if you wouldn't mind.
Yes, just give me 1 second to pull up the questions. I'm sorry, I wasn't expecting to provide a response. Hold on one quick second.
I have the question. I can read it. I can read it, Jeff.
That'd be great.
So the question is, with the sudden increase of COVID-19 cases, are there any plans to reopen more Optimum served testing sites around Imperial Valley? And the second part of that question, with the closure of the Calexico site, it has made it difficult for many to drive up to Brawley. How many people have tested on the Optimum served site in the last 2 months?
Okay, so starting with the first question, let's go with a sudden increase in COVID cases. So we're currently working with the state to expand our testing capabilities. And we are discussing the possibility of actually adding an additional, expanding our resources and adding possibly a mobile testing clinic, as well as a traveling team. And this would obviously provide us more flexibility in going out and testing, more targeted testing within our community, within our ag community and other areas of need. So that is a possibility there. But again, we're working with the state with regards to expanding our resources there. So that's still in the works. With regards to the closure of the Calexico site question, I don't believe it's impacted the community with regards to having to drive to Brawley. We do have 5 community testing sites located in Imperial County. We do still have one, a care provider is Dr. Vos providing clinical services, a community site in Calexico. We also have El Centro Regional Medical Center and Al Valley Urgent Care Center providing a community testing in the El Centro area. And then we have Pioneers Memorial Hospital, and then obviously our Optimum testing site is providing services on the north end of the county. So we have the 5 community sites that are still quite active and assisting our community or providing testing services for the community. And as far as how many people have tested on the Optimum site in the last 2 months, so from September 8th through November 4th, we've tested approximately 3,455 individuals at the Brawley site, which is, we're averaging about 88% utilization rate is about 88% for that testing site.
All right, thanks very much, Jeff. And just a few comments. The goal for the Optimum sites is to stay above 85%. And I know that in part this question was, with regard to the fact that we had closed the other sites. And the reason that we closed them is because they were not being used. And we closed them one at a time as we looked to see what utilization was around the county. And as we closed them, the utilization rates did not go up in the other sites. But once we got to the point where we only had the one left that's open now, then we were able to stay above the goal of 85%. And we do need to understand that this is taxpayer money that we're spending, and that we want to make sure that we do that appropriately and judiciously. The other thing that I would say, Jeff did a nice job of summarizing the testing that's available, but there are other test places available. For example, the health department, we are doing testing as well. So there is a robust amount of testing that is available around the county through various public-private partnerships. But as Jeff described, we are in active discussions right now, as are all the other counties and other health jurisdictions in the state, with regard to additional assets that we're hoping that we'll be able to deploy soon. So Jeff, thanks very much for that. So unless there's other questions for the health department at this time, I'll stop so that the other members of the panel can have an opportunity to speak.
Okay, are we ready to go on to our next panelist?
I would say yes, Medea.
Okay, so Mr. Larry Lewis, would you like to start?
Certainly. I guess our patient load for COVID right now has been bouncing around 10 plus or minus since mid-October. So things are relatively stable here. We have been in contact with the EMSA office and discussed the contingent of expanding our ICU capacity as we had planned during the last surge in the summertime. We currently have 8 ICU beds available. There are 6 more beds that are already equipped and staffed as a definitive observation unit, but that quickly converts to intensive care patients. And then we have equipment and plans that could be in place within just a few days for an additional 10 ICU beds on our 2nd floor. That would take some additional staffing, and we do have engagement with both the state and the registry contractors to bring registry if that occasion arises. The EMSA group was talking to us about actually preparing, if needed, to build out 10 beds in our auditorium that would be for med-surg patients that would allow for that expansion of the ICU up on the 2nd floor. Our PPE supply is really good. Everything's kind of been staged with the county or EMSA should the surge drastically increase. We've talked with them about what the needs might be, but again, it's all on ready standby at this point. As mentioned by Dr. Monday, we do have our testing available. We have ample amount of rapid testing results where it's needed, where it's appropriate. That would be available within a couple hours, and we still have access to the outside services of Quest and such that would be results within a couple of days if there's no symptoms presenting that require their admission or something. Ventilators, negative pressure rooms, outside screening, and all the other precautions that were implemented during last summer's surge remain in place. Let's see. Our physicians have been reaching out to patients whose care have been delayed over the past 6 months. And as a result, we're trying to be careful that their conditions don't worsen for something other than COVID because of such a long delay. And in short, we remain vigilant. We have protections and precautions in place, and we stand ready to support El Centro and Imperial County when and if needed. So, any questions?
Can you reiterate those ICU numbers, please?
Yeah, we have 8 existing licensed beds. We have another 6 that are, we currently place definitive observation, which is a step down from ICU, but they're literally equipped and staffed with critical care nurses and appropriate monitoring equipment. So those 6 can be immediately turned into ICU patients. And then 10 additional beds to be turned into ICU up on the 2nd floor that would be adjacent there.
How many are in use right now?
Yeah, they're in use now, but that's why the additional beds would be looked at for med-surg to be set up downstairs if a significant surge hit.
Just to clarify, the 8 beds are in use right now?
Yes, yes. We do have an additional 4 beds that we did utilize during the surge last summer, and those are immediately adjacent to the ICU. And again, those are staffing would be required for that, but that's we are planning for that contingency right now.
Thank you.
Thank you, Mr. Lewis. Now we'll continue with El Centro Regional Medical Center and Dr. Edward.
Good afternoon, everybody. I want to first start by saying that our hospitals at both ends of the spectrum, ECRMC, and I'm sure Larry would agree, are safe and open and available for care. And the reason why we're saying this, or I'm saying this, is because we are actually hearing as of lately that there's been a delay in care. That's not a good thing. We want people to know that they can actually come to the hospital and be cared for, especially cancer care. A very big emphasis on cancer care. The flu season, let's just address quickly the flu season and COVID. We've seen 1 case that have come in with COVID positive and influenza type A. And that's the only case that we've encountered. And the good news is this morning we have actually discharged that patient from the bed that he was in. So that's good news. Our ICU beds, let's talk about this since it's an interest. We have 13 COVID positive patients in ICU beds today. We have an increase from our normal 12 beds to 20 beds, ramping up to 24, and then ending up with 32 beds. That is the plan that we've been talking with EMSA about. That's the plan that we've had in place since COVID 1.0. So we're repeating it again in what we call COVID 2.0, which is the 2nd wave of COVID. The state and us are discussing an increase in med-surg capacity by adding in an external tent here in the parking lot right outside the north end on Ross. And that's going to be 50 beds, med-surg, allowing us to actually open up beds upstairs in the same vicinity of the existing ICU to expand the ICU capability. Staff is already in the works for that increase up to 24 and then ramp up in the next 2 weeks as we see the numbers increase. Supplies and PPE, I'll support what Larry was saying. We've got support from both the state as well as some pre-established supplies that are pre-staged at the county level that we can rely on. Testing is already covered. Want to address vents and negative pressure rooms. We've had the highest negative pressure rooms that I know of in any hospital. We have 85 rooms that are negative pressure rooms currently, and that's always good. That always can help us. I know that Dr. Monday, Dr. Tomaszewski, my chief medical officer, are constantly in communication regarding anything that is needed from a physician's perspective. We are looking at what's been positive. And I want to make sure that you all actually hear this and pass it out to our community. And that is the usage of remdesivir, Regeneron, which is monoclonal antibody, and treatments that our own president received at Bethesda and Walter Reed is available in this community at ECRMC and at Pioneers. And that's something that I think we ought to let the public know, that to rest assured that if they come to either one of these hospitals, they're going to be getting top-notch care that our own president received. So I'm going to stop here and see if there's any questions.
Are there any questions for Dr. Edward? Okay, if not, we are going to turn it over to Jeanette Angulo, who's going to do a brief summary of Dr. Monday's statements.
Good afternoon, everyone. And since we do have Spanish media on, I will give the summary, but in Spanish. Muy buenas tardes, gracias por acompañarnos hoy. Un resumen de lo que el oficial de salud dijo hoy en esta tarde es de que la actividad de COVID-19 está incrementando en Estados Unidos. Lo vemos aquí en California. California tiene más de 940,000 casos positivos y más de 17,000 fallecimientos. Aquí en el condado de Imperial estamos viendo más de 13,000 casos positivos y 340 fallecimientos hasta el día de hoy. En cuanto a la tasa de positividad en casos, estamos viendo, y estos son los números estatales, la tasa de positividad es de 32.2. Eso es sin ajustar, pero porque hemos hecho bastante prueba en la comunidad, el Estado da, por decir, un crédito y se ajusta esa tasa de positividad y nos encontramos en el 21.8. En cuanto al porcentaje de positividad en pruebas es del 8.4% y hasta el momento permanecemos en el nivel 1, ¿cuál es el nivel morado? Ahora, en cuanto a las pruebas comunitarias, todavía están disponibles en la ciudad de Brole. Se hizo un comentario sobre la disponibilidad de pruebas en el condado de Imperial y las personas pueden encontrar las pruebas con ciertos proveedores médicos, en algunas farmacias y, como ya dije, en el sitio comunitario de pruebas de la ciudad de Brole. Ahora, en el Departamento de Salud tenemos un laboratorio. El laboratorio, ahí se pueden hacer los exámenes de las pruebas, pero no necesariamente las pruebas están disponibles al público. Nosotros trabajamos con algunas organizaciones, como las prisiones o los centros de enfermería especializado, y de ahí se van esas pruebas que se recolectaron y ya se llevan al laboratorio del Departamento de Salud. Así es de que eso fue la información que el doctor Monday compartió con nosotros. Gracias.
Are there any questions for Jeanette from the media?
I just put one in the chat, but I can ask it out loud. Is there any updates at this point on the status of the alternative care site? What exactly are the metrics that are necessary to press the site back into service? What is the likelihood at this point that we'll hit that number?
Hi, this is Chris Herring, EMS manager with the Public Health Department. So the status of the alternate care site right now is it is patient ready. So if you all remember back in August, we took that alternate care site from essentially the hot, status that it was in, where it had patients, back down to a warm status. Essentially, the equipment and the supplies stayed in place. However, the staffing that was assigned to that facility went off onto other deployments where they were more, essentially where the resources were needed. By making that site patient ready, essentially what that means is we do have a small contingent of staff that have been working at that site to take that site back from that warm status to patient ready. So moving the equipment back into place, everything was kind of consolidated. So preparing the equipment, preparing the layout, preparing the supplies. It is a small contingent of clinical staff that are available there to basically flip the switch so we can turn that site back on and start accepting patients should the need arise. I think the second part of the question, what exactly are the metrics that are necessary? I wish there was an exact metric. It would make a lot of our lives easier and we'd be able to tell you, but there is no exact metric for that. So this is a combination. What we look at is a combination of factors. So it's the availability of hospital capacity here with our 2 local hospitals. It's also the acuity level of those patients. So are they ICU patients? Are they lower acuity patients? So essentially how sick those patients are. As well as how what we're seeing in the community as far as case transmission. So are we seeing a dramatic increase in cases, or are we seeing a steady climb or kind of a plateau? So there is no exact metric that we can look at to determine when that flip or that switch gets flipped. However, we do speak multiple times a day with both hospitals as well as the state to look at all of those different factors, both in our hospitals as well as just in our healthcare system, as well as our pre-hospital, so our EMS providers as well.
Well, my follow-up with that would be, is obviously something prompted you to change its status, and I guess I want to quantify exactly what's happening that raised concern.
Yeah, and if you have a chance to go look at our public health department dashboard and the hospital tab that's on that dashboard, you'll get a great visual of kind of where we're sitting. If you look at our hospitalization rates now compared to where they were in early May, we're sitting about the same spot. I think an important difference there is the rate of increase of those hospitalizations isn't quite as dramatic as we were seeing in May, but just the numbers kind of ticking up is what prompted us as a healthcare system with our 2 hospital partners and the state to start moving resources to kind of prepare our healthcare system should we continue to see that increase in hospitalizations, whether they were lower acuity or higher acuity patients.
Okay, thank you.
I think the other piece to add to that, and I know Dr. Edward touched on it as well, as we move into fall, winter, our seasonal flu and other respiratory illnesses that just circulate in the community generally, those are all going to have an overall impact on our healthcare system. So we want to make sure that we have the resources in place to prepare our healthcare system should we see an increase, whether it's COVID, influenza, or other respiratory viruses.
Thank you, Chris. Are there any other questions? Okay, Jeanette, is there something that you wanted to share at this point?
Just to add a little bit of clarity on Dr. Monday's statement about COVID-19 testing available in the public health department. We have a laboratory that runs the specimen, but actually the test itself being available to the public, it is not. So we use the Optimum Surf site and all other sites in Imperial County. Just that, and then the question that is in the chat. Thank you.
Right, and so there is a question in the chat room regarding, from Mr. Hughes, I believe, and it says, given the high rate of coronavirus-related deaths in the county, what role do you think the fear of infection and death played in lowering voter turnout across the county? What could the county have done differently to ensure that more people could have voted safely? Tony, will you be
Yeah,
responding?
Maria, I can take a stab at that. So actually, I think we put a great deal of safety measures up for all voters coming into the polling places. For any of you guys that covered any stories at the voting polls or came in to vote yourselves, I think you would have saw we put a great deal of dividers up, spaced everything out, try to minimize the people. If you would have saw the line standing outside the facilities, we asked for people to stay 6 feet apart, which created longer lines than what it would look like longer lines, but still substantial lines. As far as the turnout, I think with everything actually going on, I think it was a decent turnout, or at least appeared to be a decent turnout. I also have Lindsay on here. Lindsay's handling a lot of the press data and stuff, so she might be able to discuss a little bit more about percentages and stuff. But I think there was a great deal of the state put out a lot of guidelines to ensure safety. We had a lot of sanitization occurring. Made sure our poll workers had the proper PPE to care not just for themselves, but make sure they didn't cross-contaminate or contaminate or have any issues with people coming in as far as poll workers versus the actual citizens. So great deal of work was put into it. Hopefully it didn't impact it a lot. I think you're seeing that across our nation, that we did have a great turnout and a lot of activity. In fact, that's why we still don't have certain results nationwide yet. But hopefully it didn't impact it too much, but I think we did as much as we could do.
Thank you. So moving on to the questions, I wanted to ask in Spanish, si hay medios de comunicación que tienen una pregunta para los panelistas. Are there any other questions from the media for any of our panelists or subject matter experts?
Maria, this is Jeanette. I don't hear any questions, but you know, we do want to announce what's happening with our flu clinics because we do need the assistance from our media partners because of our weather. This Saturday, high winds. We will postpone our drive-through flu clinic that was happening at the fairgrounds. It's for the safety of the public and our staff. At this point in time, we are working with the fairgrounds to secure a new date. And as soon as that is secure, we will announce it widely to the community. So at this time, the mass drive-through flu clinic that was taking place on Saturday, November 7th, is postponed. La clínica masiva que iba a tomar lugar el sábado, este sábado 7 de noviembre, se va a posponer por cuestiones del clima. Va a haber mucho viento y por la seguridad del público y la seguridad del personal que va a trabajar la clínica, la vamos a posponer. Estamos trabajando con los terrenos de la feria, los oficiales, para ver otra fecha y así anunciarla al público en general. Pedimos disculpas, pero la seguridad de las personas, del personal es primero. We do apologize for the inconvenience this may cause, but you know, the public's and the staff's safety is first. Thank you.
Jeanette, I think it's important to point out, though, you guys had a very successful flu clinic last week also, and serviced probably 1,000 cars, or at least families within 1,000 cars, and over almost 1,400 shots were flu shots were administered. And being part of that was pretty impressive to see the public health staff and the hospitals working together, and some of our community partners really making that a success. And having a family of 4 or 5 be able to get a shot and be in and out in an hour, even an hour and a half maybe, is a lot better than sitting in the doctor's office for a couple hours per person. So kudos to that, you guys. It was a big success, and we will reschedule. However, if the people that were involved or drove by last week and saw the large tents, it's essential to have the tents out there for cooling medications and being able to do stuff in the shade and administer the medications. So We're going to have up to 40-mile-an-hour winds on Saturday, and that was just kind of well over the limit to be putting tents up and making it feasible for us.
Thank you so much. So if there's no more questions from media, I believe this is going to be the end of our joint news conference today. And we do want to continue providing information jointly and sharing it with local media. So we will be sharing those announcements as soon as we have them available. So thank you everybody who joined us today, and thank you to our partner agencies, to El Centro Regional Medical Center, Pioneers Memorial Health District, County of Imperial, CEO, Supervisor Blancarte. Thank you for joining us and this partnership. And thank you especially to our local media.
Thanks, everybody.
Thank you.